Hello friends, this is the video basically to show you how to have a chiseled jawline or a Brad Pitt jawline using a dermal filler. We are also doing the face rejuvenation for the same patient. This is the complete real-time video, no edit, nothing. As the procedure is being performed, it is being shown to you. So right now I'm doing a markings. I'm marking the inferior border of the mandible, and you have to make sure approximately 5 to 7 millimeter above that you will get the specific area which you want to enhance. I'm injecting local anesthesia. Also, there is a marking done for the ascending ramus of the mandible. So the angle of the mandible, we need to make it a very prominent, and that is the key to have a very good muscular jawline. After injecting a local anesthesia using a normal needle, we have done the piercing and we have created a space for the cannula. Well, this particular procedure is being done, so you inject comparatively at the superficial layer, like just below or beneath the dermal layer of the skin. As you can see, using a needle, I have done little bit of, you can say, undermining, and I'm using a filler which is called as a bioregene. It is a comparatively a very good quality filler. Just on a safety side, you make sure you are using a cannula, because when you use cannula, there is a possibility of injecting into the any blood vessel is really less. So that actually enhances the safety whenever you are doing any dermal filler. Well, I have right now injected into the inferior border of the mandible, and now I'm planning to inject it on a ascending ramus of the mandible also, and I'm planning to give a very obtuse angle to the patient, so that angle gives you the muscular look. Whenever you inject the dermal filler, the patients are very comfortable. You can easily carry out the procedure. There is no pain, and when the patient is not into the pain, it is really convenient for you to negotiate the needle and inject wherever you want to. These fillers are not permanent. These are temporary. Generally, the effect lasts for like 6 months to 12 months, depend upon the quality of the filler what you are using. Right now, I am injecting the little higher molecular version of the filler. These are all the HA fillers. It is basically called the hyaluronic acid derivative or the peptides fillers. These are the dissolvable one. Now, at the junction, just to give more prominence, I am injecting filler, little superficial, but in a droplet pattern. Here, patient is already having a little bit of a bifid chin. When the chin gets divided in a center, and you get the two equal segment on both the sides are called as a bifid chin. Patient wanted to enhance that. So right now I'm injecting a higher molecular weight on the bone to give the much better foundation to the fillers and give a better prominence. And whenever you use the combination of a higher molecular at the deeper layer and the lower molecular layer fillers at the superficial layer, you undoubtedly get a much more long lasting results. Right now on the right side you can see the angle of the mandible is become very prominent. It's less than even 5 minutes we have injected a filler, but you can see the prominence on the right side. At the center and on the left side I'm just doing a marking. Similar marking what I have done on the right side, I'm just copying it on the other side. Again, as I told you, I'm just injecting a little local anesthesia at the entry point. So patient remains comfortable during a procedure. A lot of patients are always concerned, like, sir, like, it's not a permanent, so what's the point of doing it? So there are fillers which is permanent, like the silicone oil. Also, if somebody wants, we can inject fat grafting, we can do to enhance the volume. But when you want to inject a filler, you can get the specific dimensions. You can give a specific shape to the specific contour to the face, which is definitely not possible with the fat. Fat can just increase the bulk, but if you want to give a one specific shape to the any specific anatomical part of the body, it is very difficult because it do not sustain there as it is. While the best advantage of this filler, it sustains there. Also, the silicone oil is a permanent fillers, but whenever there is a permanent filler, it is a permanent problem. So in today's time, most of the surgeons, most of the doctors, they are just using hyaluronic acid. Of course, nowadays the filler which is available, you can increase the durability by 4 years, 5 years. You can use that, but these are all temporary procedures. And these are like the lunchtime procedures, not even lunchtime, you can say even less than that. We'll be able to finish this particular case just in a 12 to 13 minutes. Also, the cost is always a concern for the patient. So the cost highly depend upon the two things. The one is the which brand filler you are using, because there are a lot of brands which is available. You have a cheaper fillers also, and you have the very expensive one also. It up to you, which brand you want to use. And the secondly is the experience of a surgeon. Well, right now he is having a little tear trough. So we have a very specific needle which is a very small, we specifically use for the face rejuvenation or just into the tear trough area. And I'm just injecting the small boluses of the filler. It's a comparatively a low molecular weight. I'm just injecting in a tear trough area, also in an infraorbital area, to give a very unique, you can say, the outline on a face, because a little depression in an infraorbital area is something very common, and it can start even at the age of 30-35. So I'm just injecting in general small boluses of a filler in an infraorbital area, just not on a tear trough but infraorbital area. And right now you can appreciate, the left side was not done and the right side was done, and there was a difference. Now the similar thing I'm doing even on a left side. Also, I want to mention you, before I have done the infraorbital nerve block. If you can do infraorbital nerve block intraorally, that is always great. So you do not distort the structure out there, and you can give a better results. So these filler procedures are very common, okay, and it is just not the anti-aging, but nowadays it is also for a facial sculpting. You can change the shape of your lower jaw, you can change the shape of your chin, you can change the shape of lips. So that is all possible with the fillers, and it works wonderful. It works wonderful. It's one of the very safe procedure. And right now I was injecting in a nasolabial fold and the marionette lines. The nasolabial fold, also called as the laugh lines, and these are the comparatively superficial injections what I'm injecting. That depends, you have to evaluate each patient. Not necessarily all the patients require the same treatment. You have to customize the treatment as per the requirement of the patient. This is, I'm doing a marking of the zygomatic arch and the malar eminence. I just wanted to enhance little bit of the upper jaw also, so the face look very much symmetrical. If the lower jaw is too much muscular, and there is a less muscularization on the upper jaw, it never looks good, because the proportion on a face gives you better results. So I'm injecting small boluses of filler on the malar eminence as well as the zygomatic arch. And this is the complete face what we are doing. We are enhancing the lower jaw. We have done the muscular jawline. We have done the infraorbital, nasolabial, marionette lines. Now these are the deep injections, okay, which I am giving at the angle of the mandible. So that will be helpful for the patient to increase the durability of the fillers. When you do such things, even the durability increases to 12 months to 18 months. So these are the deep injection. You can see I am injecting at the full length. So depth, at what depth you are injecting is very important. And now we have the before after result. You can appreciate how the patient looks. And thank you so much. I am Dr. Vaibhav Shah. My practice is only in Mumbai, Borivali. I am a maxillofacial surgeon, and my special interest is into the facial cosmetic procedures and the surgeries. Kindly check out our all the videos. And if you have a question, doubts, we are happy to help you. You can get in touch with us. The phone number is there. The link is available. Thank you so much, guys. Thank you so much.